The blood supply, the arteries involved are cervicovaginal branch of uterine artery, vaginal artery, a branch of anterior division of internal iliac or in common origin with the uterine, middle rectal, internal pudendal. These anastomose with one another and form two azygote arteries, anterior and posterior. Veins drain into internal iliac veins and internal pudendal veins. Lymphatics on each side, the lymphatics drain into upper one-third internal iliac group, middle one-third to hymen internal iliac group. Below the hymen, it is superficial inguinal group. The nerve supply, vagina is supplied by sympathetic and parasympathetic from the pelvic plexus. The lower part is supplied by the pudendal nerve. Development. The vagina is developed from the following sources. Upper forefifth, above the hymen, the mucous membrane is derived from the endoderm of the canalized sinovaginal pulse. The musculature is developed from the mesoderm of the two fused Mullerian ducts. Lower one-fifth below the hymen is developed from the endoderm of the urogenital sinus. External vaginal orifice is formed from the genital fold, ectoderm, after rupture of urogenital membrane. The uterus is a hollow pyriform muscular organ situated in the pelvis between the bladder in the front and rectum behind. In normal position, one of the anteversion and anteflexion. The uterus usually inclines to the right, dextrorotation, so that the cervix is directed to the left and comes in close relation. Uterus measures about 8 cm long, 5 cm wide, and its walls are about 1.25 cm thick. It varies from 50 grams to 80 grams. It has got the following parts: body or corpus, isthmus, and cervix. Body or corpus. The body is further divided into fundus, the part which lies above the openings of the uterine tubes. The body proper is triangular and lies between the openings of the tubes and the isthmus. The superolateral angles of the body of the uterus project outwards from the junction of the fundus and body and is called the cornu of the uterus. Uterine tube, round ligament and ligament of ovary are attached to it. Isthmus is a constricted part measuring about 0.5 centimeters situated between the body and the cervix. It is limited above by the anatomical internal os and below by the histological internal os. Some consider isthmus as a part of the lower portion of the body of the uterus. Cervix is cylindrical in shape and measures about 2.5 centimeters. It extends from the isthmus and ends in the external os, which opens into the vagina after perforating its anterior wall. The part lying above the vagina is called supravaginal, and that which lies within the vagina is called vaginal part. Cavity. The cavity of the uterine body is triangular or coronal section with the base above and the apex below. It measures about 3.5 centimeter. There is no cavity in the fundus. The cervical canal is fusiform and measures about 2.5 centimeter. Thus, the normal length of uterine cavity is usually 6.5 to 7 centimeter. Anteriorly, above the internal os, the body forms the posterior wall of the uterovesical pouch. Below the internal os, it is separated from the base of the bladder by loose alveolar tissue. Posteriorly, it is covered with peritoneum and forms the anterior wall of the pouch of Douglas containing the coils of intestine. Laterally, the double fold of peritoneum of the broad ligament are attached between the uterine artery, which the uterine artery ascends up. Attachment of Meckenrod's ligament extends from the internal os down to the supravaginal cervix and lateral vaginal wall. About 1.5 centimeter away at the level of the internal os, a little nearer on the left side is the crossing. Laterally, the double fold of peritoneum of the broad ligament are attached between the between which the uterine artery ascends up. Attachment of the McIntosh ligament extends from the internal down to the supravaginal cervix and lateral vaginal wall. About 1.5 centimeter away at the level of internal os, a little nearer on the left side is the crossing of the uterine artery and the ureter. The uterine artery crosses from above and in front of the ureter soon before the ureter enters the ureteric tunnel. Body. The wall consists of three layers from outside inwards. Parametrium, it is the serous coat which invests the entire organ except on the lateral borders. The peritoneum is intimately adherent to the underlying muscles. Myometrium, it consists of thick bundles of smooth muscle fibers held by connective tissue and are arranged in various directions. During pregnancy, however, three distinct layers can be identified: outer longitudinal, middle interlacing, and inner circular. Endometrium. The mucous lining of the cavity is called endometrium. As there is no submucous layer, the endometrium is directly opposed to the muscle coat. It consists of lamina propria and surface epithelium. The surface epithelium is a single layer of ciliated columnar epithelium. The lamina propria contains stromal cells, endometrial glands, vessels, and nerves. The glands are simple, tubular, and lined by mucus-secreting non-ciliated columnar epithelium, which penetrate the stroma and sometimes even enter the muscle coat. The endometrium is changed to decidua during pregnancy. Cervix. The cervix is composed mainly of fibrous connective tissue. The smooth muscle fibers average 10 to 15%. Only the posterior surface has got peritoneal coat. Mucus coat lining the endocervix is simple columnar with basal nuclei, and that lining the gland is non-ciliated secretory columnar cells. The vaginal part of the cervix is lined by stratified squamous epithelium. The squamocolumnar junction is situated at the external os. Secretion. The endometrial secretion is scanty and watery. Secretion of the cervical glands is alkaline and thick, rich in mucoprotein, fructose, and sodium chloride. Peritoneum in relation to the uterus. Raised anteriorly, the peritoneum covering the superior surface of the bladder reflects over the anterior surface of the uterus at the level of the internal os. The pouch so formed is called uterovesical pouch. The peritoneum thereafter is firmly attached to the anterior and posterior walls of the uterus and upper one-third of the posterior vaginal wall, where it is reflected over the rectum. The pouch so formed is called the pouch of Douglas. Traced laterally, the adherent peritoneum of the anterior and posterior walls of the uterus is continuous laterally, forming the broad ligament. Laterally, it extends to the lateral pelvic wall, where the layers reflect to cover the anterior and posterior aspects of the pelvic cavity. On its superior free border lies the fallopian tube, and on the posterior layer, the ovaries attached by mesomeres. The lateral one-fourth of the free border is called infundibulopelvic ligament. Blood supply, arterial supply. The blood supply is from the uterine arteries, one on each side. The artery arises directly from the anterior division of internal iliac or in common with superior vesical artery. The other sources are ovarian and vaginal arteries, with which the uterine artery is anastomosed. The internal supply of uterus is shown in figure. Venous channel corresponds to the arterial course and drain into the internal iliac veins. Lymphatics. Body. From the fundus and upper part of the body of the uterus, the lymphatics drain into pre-aortic and lateral aortic group of glands. Cornu drains to the superficial inguinal gland along the round ligament. Lower part of the body drains into the external iliac groups. Cervix. On each side, the lymphatics drain into external iliac, obturator lymph node either directly or through the paracervical lymph nodes, internal iliac groups, sacral groups. Nerves. The nerve supply of uterus is derived principally from the sympathetic system and partly from parasympathetic system. Sympathetic components are T5 and T6 motor and T10 to 11 spinal segments. The somatic distribution of uterine pain is that area of the abdomen supplied by T10 to L8. The parasympathetic system is represented on either side by pelvic nerve, which consists of both motor and sensory fibers from S3S4 and ends in the ganglia of Frankenhausen. The cervix is insensitive to touch, heat, and also when it is rasped by instrument. Uterus too is insensitive to handling and even to incision over its wall. Development. The uterus is developed from the fused vertical part of the two Mullerian ducts. Now the fallopian tube. Synonymous uterine tube oviduct. The uterine tubes are paired structures measuring about 10 centimeter and are situated in the medial three-fourths of the upper free margin of the body. Each tube has got two openings, one communicating with the lateral angle of the uterine cavity called uterine opening and measures 1 mm in diameter. The other is on the lateral end of the tube called pelvic opening or the abdominal ostium and measures about 2 mm in diameter. There are four parts from medial to lateral, intramural or interstitial lying in the uterine wall and measures 1.25 centimeter in length and 1 mm in diameter. Isthmus almost straight and measures about 3/4 to 4 centimeter in length and 2 mm in diameter. Ampulla tortuous part and measures about 5 centimeter in length, which ends in wide infundibulum measuring 1.25 centimeter long with a maximum diameter of 6 mm. The abdominal ostium is surrounded by a number of radiating fimbriae, 20-25. One of them is longer than the rest and is attached to the outer pole of the ovary called ovarian fimbriae. Structures. It consists of three layers. Serous consists of peritoneum on all sides except along the line of attachment of mesosalpinx. Muscular arranged in two layers, outer longitudinal and inner circular. Mucous membrane has three different cell types and is thrown into longitudinal fold. The epithelium rests on a delicate vascular reticulum of connective tissue. Mucous membrane is lined by columnar ciliated epithelial cells that are most predominant near the ovarian end of the tube. These cells compose 25% of mucosal cells. Secretory columnar cells are present at the isthmial segment and compose 60% of the epithelial cells. Pec cells are found in between the above two cells. They are the variant of secretory cells. Functions. The important functions of the tube are transport of the gametes to facilitate fertilization and survival of zygote through its secretion. Blood supply. Arterial supply is from uterine and ovarian. Venous drainage is through the cambriform plexus into the ovarian veins. Lymphatics run along the ovarian vessels to the para-aortic node. Nerve supply is derived from uterine and ovarian nerves. The tube is very much sensitive to the handling. Development. The tube is developed from the upper vertical part of the corresponding Mullerian duct at about 6 to 8 10th week. The ovaries are paired sex glands or gonads in female, which are concerned for germ cell maturation, storage and its release, and steroidogenesis. The gland is oval in shape and pinkish gray in color, and surface is scarred during the reproductive period. It measures about 3 centimeter in length, 2 centimeter in breadth, and 1 centimeter in thickness. Each ovary presents two ends, tubal and uterine, two borders, mesovarium and three posterior, and two surfaces, medial and lateral. The ovaries are intraperitoneal structures. In Nulliparra, the ovary lies in the ovarian fossa on the lateral pelvic wall. The ovary is attached to the posterior layer of the broad ligament by mesovarium, to the lateral pelvic wall by the infundibulopelvic ligament, and to the uterus by the ovarian ligament. Mesovarium or anterior border. A fold of peritoneum from the posterior leaf of broad ligament is attached to the anterior border through which the ovarian vessels and nerves enter the hilum of the gland. Posterior border is free and is related to the tubal ampulla. It is separated by the peritoneum from the ureter and the internal iliac artery. Medial surface is related to fimbrial part of the tube. Lateral surface is in the contact with the ovarian fossa on the lateral pelvic wall. The fossa is related superiorly to the external iliac vein, posteriorly to the ureter and internal iliac vessels, and laterally to the peritoneum, separating the obturator vessels and nerves. Structures. The ovary is covered by a single layer of cubical cell known as germinal epithelium. The substance of the gland consists of outer cortex, inner medulla. The cortex, it consists of stromal cells which are thickened beneath the germinal epithelium to form tunica albuginea. During reproductive period, that is from the puberty to menopause, the cortex is studded with numerous follicular structures called the functional units of the ovary in various phases of their development. These are related to sex hormone production and ovulation. The structures include primordial follicles, maturing follicles, Graafian follicles, and corpus luteum. Atresia of the structure results in formation of atretic follicles or corpus albicans. Medulla, it consists of loose connective tissue, few unstressed muscles, blood vessels, nerves. There is a small collection of cells called hilous cells, which are homologous to the interstitial cells of the testis. Blood supply. Arterial supply is from the ovarian artery, a branch of abdominal aorta. Venous drainage is through the campaniform plexus to form the ovarian veins, which drain into inferior vena cava on right side and left renal vein on the left side. Part of the venous blood from the placental side drains into the ovarian veins and thus become the site of thrombophlebitis and puberty. Lymphatics. Through the ovarian vessels drain to the para-aortic lymph nodes. Now sympathetic supply comes down along the ovarian artery from the T10 segment. Ovaries are sensitive to manual squeezing. Development. The ovaries develop from the cortex of the undifferentiated genital ridges by about 9th week. The primary germ cells reaching the site migrating from dorsal end of the yolk sac. Muscles and the fascia in relation to the pelvic organ. The most important muscle supporting the pelvic organ is the levator ani, which forms the pelvic floor. The small muscles of the perineum also have got some contribution. Pelvic floor. Pelvic floor is a muscular partition which separates the pelvic cavity from the anatomical perineum. It consists of 3 sets of muscles on either side, pubococcygeus, iliococcygeus, and ischio-coccygeus, and these are collectively called levator ani. Its upper surface is concave and slopes downwards, backwards, and medially, and is covered by parietal layer of pelvic fascia. The inferior surface is convex and is covered by anal fascia. The muscle with the covering fascia is called pelvic diaphragm. Origin. Each levator ani arises from the back of the pubic rami, from the condensed fascia covering the obturator internus, and from the inner surface of the ischial spine. From this extensive origin, the fibers pass backward medially to be inserted in midline from before backwards to vagina, lateral and posterior walls, perineal body, anococcygeal raphe, lateral borders of the coccyx and lower part of the sacrum. Gaps. There are 2 gaps in the midline. The anterior one is called hiatus urogenitalis, which is bridged by the muscles and fascia of the urogenital triangle and pierced by urethra and vagina. The posterior one is called hiatus rectalis, transmitting the rectum. The superior surface is related with the following: pelvic organs from anterior to posterior, bladder, vagina, uterus, and rectum. Pelvic cellular tissues between pelvic peritoneum and upper surface of levator ani, which fill all the available spaces. Ureter lies on the floor in relation to the lateral vaginal fornix. The uterine artery lies above and the vaginal artery lies below it. Pelvic nerves. The inferior surface is related to the anatomical perineum. Now it is supplied by the 4th sacral nerve, inferior rectal nerve, and perineal branch of the pudendal nerve S234. Functions. To support the pelvic organ, the puba vaginalis forms a U-shaped sling, supports the vagina, which in turn supports the other pelvic organs, bladder and uterus. Weakness or tear of this sling during parturition is responsible for prolapse of the organs concerned. To maintain intra-abdominal pressure by reflexly responding to its changes. Facilitates anterior internal rotation of the presenting part when it presses on the pelvic floor. Puborectalis plays an ancillary role to the action of external anal sphincter. Ischio-coccygeus helps to stabilize the sacroiliac and sacrococcygeal joints to steady the perineal body. Pelvic floor during pregnancy and parturition. During pregnancy, levator muscles undergo hypertrophy, become less rigid and more distensible. Due to water retention, it swells up and sags down. In the second stage, the pubovaginalis and puborectalis relax and the levator ani is drawn up over the advancing presenting part In the second stage, failure of the levator ani to relax at the crucial moment may lead to extensive damage of the pelvic structure. The effect of such a displacement is to elongate the birth canal, which is composed solely of soft parts below the bony outlet. The soft canal has got deep lateral posterior walls and its axis is in continuation with the axis of the bony pelvis. Perineum. Anatomical perineum is bounded above by the inferior surface of pelvic floor, below by the skin between the buttocks and thighs. Laterally, it is bound by the ischiopubic ramus, ischial tuberosities, and sacrotuberous ligaments, and posteriorly by the fossa. The diamond-shaped space of the bony pelvic outlet is divided into two triangular spaces in common base formed by the free border of the urogenital diaphragm. The anterior triangle is called urogenital triangle, which fills up the gap of the hiatus urogenitalis and is important from the optic point of view. The posterior one is called the anal triangle. Urogenital triangle. It is pierced by the terminal part of vagina and urethra. The small perineal muscles are situated in two compartments formed by the ill-defined fascia. The compartments are superficial and deep perineal pouch. The superficial pouch is formed by deep layer of superficial perineal fascia, Cooley's fascia, and inferior layer of the urogenital diaphragm perineal membrane. The contents are superficial transverse perineum, paired, bulbospongiosus covering the bulb of the vestibule, ischiocavernosus paired covering the crura of the clitoris, and the Bartholin's glands paired. The deep perineal pouch is formed by inferior and superior layer of urogenital diaphragm, together called urogenital diaphragm or triangular ligament. Between the layers, there is a potential space of about 1.25 centimeter. The contents are the following muscles: deep transverse perineum and sphincter urethrae membranaceae. Both pouches contain vessels and nerves. Anal triangle, it has got no obstetric significance. It contains the terminal part of anal canal with sphincter ani externus, anococcygeal body, ischiorectal fossa, blood vessels, nerves, and lymphatics. Obstetrical perineum. Synonyms: perineal body, central part of the perineum. The pyramidal shaped tissue where the pelvic floor and perineal muscles and the fascia meet in between the vagina and the anal canal is called obstetrical perineum. It measures 4 by 4 centimeter with the base covered by perineal skin and the apex is pointed and is continuous with the rectovaginal septum. The musculofacial structures involved are fasciae, two layers of superficial perineal fascia, superficial fatty layer, and deeper layer called Cooley's fascia, inferior and superior layer of urogenital diaphragm together called triangular ligament, muscles, the superficial and deep transverse perineum, bulbospongiosus, levator ani, pubococcygeus part situated at the junction of upper two-third and lower one-third of vagina, sphincter ani externus. Importance: it helps to support the levator ani, which is placed above it. By supporting the posterior vaginal wall, it indirectly supports the anterior vaginal wall, bladder, and the uterus. It is vulnerable to injury during childbirth. Deliberate cutting of the structures during delivery is called episiotomy. Pelvic fascia. For descriptive purpose, the pelvic fascia is grouped under the heading that covers the pelvic wall, the pelvic floor, and pelvic viscera. Fascia on the pelvic wall, it is very tough and membranous. It covers the obturator internus and piriformis and gets attached to the margins of the bone. The pelvic nerve lies external to the fascia, but the vessel lies internal to it. Fascia on the pelvic floor, it is not tough but loose. The superior and the inferior surfaces are covered by parietal layer of pelvic fascia, which runs down from the white line to merge with the visceral layer of the pelvic fascia, covering the anal canal. Fascia covering the pelvic viscera. The fascia is not condensed and often contains loose areolar tissue to allow distension of the organs. Pelvic cellular tissue. It lies between the pelvic peritoneum and pelvic floor and fills up all the available empty spaces. It contains fatty and connective tissue and unstriated muscle fibers. Its distribution around the vaginal wall, supravaginal part of the cervix, and into the layers of the broad ligament is called parametrium. The condensation occurs especially near the cervicovaginal junction to form ligaments which extends from viscera to the pelvic wall to the either side. These are McIndoe ligament, uterosacral ligament, and vesicocervical ligaments. All these constitute important supports of the uterus to keep it in position. to support the pelvic organs to form the protective sheath for the blood vessels and the terminal part of the ureter. Infection spreads along the tract so formed outside the pelvis to the perinephric region, along the ureter, to the buttock, along the gluteal vessels, to the thigh, along the external iliac vessels, and to the groin along the round ligament. Marked hypertrophy occurs during pregnancy to widen up the spaces. Female urethra. The female urethra extends from neck of the bladder to the external urethral meatus, which opens into the vestibule about 2.5 centimeter below the clitoris. It measures about 4 centimeter and has a diameter of 6 mm. Its upper half is separated from the anterior vaginal wall by loose areolar tissue, and lower half is firmly embedded in its wall. Numerous tubular glands called paraurethral glands open into the lumen through the ducts. Of these, two are larger called Skinner's duct, which open either on the posterior wall just inside the external meatus or into the vestibule. These glands are the sites for harboring infection and occasional development of benign adenoma or malignant changes. While piercing the deep perineal pouch, it is surrounded by sphincter urethral membranaceae, which acts as an external sphincter. Now the structure. Mucous membrane in the distal 1/3 is lined by stratified squamous, but in proximal 2/3 it becomes stratified transitional epithelium. Mucous coat is vascular. Muscle coat is arranged as inner longitudinal and outer circular. Blood supply, arterial supply, proximal parts are supplied by inferior vesical branch and the distal part by a branch of internal pudendal artery. The veins drain into vesical plexus and into the internal pudendal veins. Lymphatics, the lymphatics drain into superficial inguinal glands and rest drain into internal and external iliac group of glands. Nerve supply, it is supplied by pudendal nerve. Development, the urethra is developed from vesico-urethral portion of the cloaca. Urinary bladder. The bladder is a hollow muscular organ with considerable power of distension. Its capacity is about 450 ml, but can retain as much as 3 to 4 liters of urine. When distended, it is ovoid in shape. It has got an apex, superior surface, base to infralateral surface and neck, which is continuous with the urethra. The base and neck remain fixed even when the bladder is distended. Relation. The superior surface is related with peritoneum of the utrovesical pouch. The base is related with supravaginal cervix and anterior cornea. The ureters, after crossing the pelvic floor at the sides of the cervix, enter the bladder on its lateral angles. In the interior of the interior of the bladder, the triangular area marked by 3 openings, 2 ureteric and 1 urethral, is called trigone. The inferolateral surface are related with the space of trapezius. The neck rests on the superior layer of the urogenital diaphragm. Structures from outside inwards: outer visceral layer of pelvic fascia, muscle layer composed of muscles running in various directions near the internal urethral opening, the circular muscle fibers provide involuntary sphincter. Mucous coat is lined by transitional epithelium with no gland. There is no submucous coat. Blood supply. The blood supply is through superior and inferior vesical arteries. The veins drain into vesical and vaginal plexus. And there two internal iliac veins. Lymphatics drain into external and internal iliac lymph nodes. Nerve supply. Sympathetic supply is from pelvic plexus and parasympathetic via the pelvic plexus from the nervi end, laryngitis. S234. The parasympathetic produces contraction of detrusor muscles and relaxation of internal sphincter. Sympathetic conveys afferent painful stimuli of over distension. Development: urinary bladder is developed from upper part of urogenital sinus. Pelvic ureter. It extends from crossing of ureter over the pelvic brim up to its opening into the bladder. It measures about 13 centimeter in length and has a diameter of 5 mm. Ureter is retroperitoneal in course. Course and relation. The ureter enters the pelvis in front of the bifurcation of common iliac artery over the sacroiliac joint, behind the root of the mesentery on right side and apex of the mesosigmoid on the left side. As it courses downward in contact with the peritoneum, it lies anterior to the internal iliac artery and behind the ovary and forms the posterior boundary of ovarian fossa. On reaching the ischial spine, it lies over pelvic floor, and as it courses forward and medial on the base of the broad ligament, It is crossed by the uterine artery anteriorly. Soon it enters into ureteric tunnel and lies close to the supravaginal part of the cervix, about 1.5 centimeter lateral to it. After traversing a short distance on the anterior fornix of vagina, it courses into the wall of the bladder obliquely for about 2 centimeters by piercing the lateral angle before it opens into the base of the trigon. In the pelvic portion, the ureter is comparatively constricted where it crosses the pelvic brim, where crossed by uterine artery and the intravesical part. Structures from outside inwards, fibers derived from visceral layer of pelvic fascia, muscle coat consisting of 3 layers, outer and inner longitudinal and intermediate circular. Mucus layer lined by transitional epithelium. Blood supply, it has got segmental supply from nearly all visceral branches of the anterior division of internal iliac, uterine, vaginal, vesical, middle rectal and superior gluteal arteries. The venous drainage corresponds to the arteries. Lymphatics, the lymphatics from the lower part drain into the external and internal iliac lymph nodes and upper part into the lumbar lymph nodes. Nerve supply, the sympathetic supply is from the hypogastric and the pelvic plexus. Parasympathetic from sacral plexus. Development, it is developed as an ureteric bud from the caudal end of the mesonephric nerve. Thank you.